Do you take an active role in maximizing your health? Do you research options to help make the best health care choices? Do you know what type medicine your primary care doctor practices? Is it allopathic medicine, homeopathic medicine, or is it naturopathic medicine? And what is the difference between the three? Today we talk with two doctors who will bring clarity to the matter. Grab your pen and paper. I encourage you, take a note.
Maybe you can make retirement happen. After all, you made home ownership happen. Homeschooling yourself on loans, beefing up your credit score.
So I'm pre-approved.
You were like, yes! Sorry. Color coding listings, ticking boxes, and flushing every toilet in a 20-mile radius. Home sweet home. You aced house hunting. Now get the tips you need to get on track at aceyourretirement.org.
Hello and welcome to the Clarion Call TV show. I am Janice Hatcher-Lickens, your host. The Clarion Call as a nonprofit works with families to plot a successful path forward. This show helps us to expose the community to available resources by showcasing other organizations and their services. Joining us today are Dr. Vida Johnson, a licensed doctor of naturopathic medicine and founder of All Things Natural Wellness Center. Also with us is Dr. Paula Stewart, also a licensed doctor of naturopathic medicine and as well is a licensed acupuncturist. Ladies, welcome to the show. I'm so glad to have you with us.
Thank you.
So glad to have you with us. So let's start off. A lot of people talk about doctors, and there are many different types of doctors. You're naturopathic doctors. What is that?
Well, a naturopathic doctor is trained in natural, different modalities of natural medicine. Mm-hmm. So modalities could be acupuncture, homeopathy, botanical medicine, counseling, hydrotherapy, which is working with water, and many other avenues, as well as being trained as a doctor.
Okay. Mm-hmm. So what's the difference then between a doctor of naturopathic medicine and a traditional doctor? Most people in our country have grown up doing traditional medicine. They call it traditional medicine, allopathic medicine or allopathy. What's the difference between allopathic medicine and naturopathic medicine?
So allopathic medicine and naturopathic medicine, when you are in medical school, you have 4 years of science and clinical work. And so naturopathic medical doctors and allopathic medical doctors do the same thing. Afterwards, we do clinical training and they do residency. So when we're in our clinical training, we learn about the different modalities that Dr. Johnson mentioned as far as treating the patient. Mm-hmm. So we learn how to diagnose, we do cadaver lab as well in the beginning, and then in the end, we learn how to treat naturally. So botanical medicines again, nutrition, diet, exercise, as well as physical medicine, just doing chiropractic-like adjustments.
Okay, so you said something that caught my attention. You said you did cadaver labs.
Cadaver labs, correct. Mm-hmm.
I kind of think I know what that means, but tell me.
So what we have in an anatomy lab is a cadaver, which is a body of a deceased person, and the patient's family donates the body to science. Okay. And so what our job is to look at the body, to dissect it. We analyze the different nerves, we look at the muscles, we look at the brain, so we learn how to dissect the brain as well. So wow. That's what the cadaver lab is.
Wow, so that's intense medical training.
Yes, it is.
Right. Actually, that's wonderful. And so what's the difference between naturopathic and homeopathic medicine?
So homeopathic medicine is a type of medicine that treats on the principle of like cures like. So for instance, if someone was having insomnia, meaning that they cannot get to sleep, right? Well, one of the ways that you can treat is with coffee, because coffee induces the same type of symptoms of keeping you up. So it's like cures like. And so the body reacts and is able to then thereby go to sleep.
And from what I understand, though, and I think I heard you say, is homeopathy is a part of your naturopathic practice. You've incorporated it as a part of. So it's an umbrella. Naturopathic medicine is an umbrella medication or treatment, I should say.
Right.
Is that right?
That's correct. Yes.
Right.
Yes.
And in our training, we also, we do pharmacology and the whole gambit, minor surgery. So we are trained in a very similarly to medical doctors in many aspects, and we use the same books and all. And depending on what state that you're in, depends on your scope of practice and how you can practice in that particular state.
I think it's important to note, because I'm one of those people, and I know there are many, who thought, you could just go online somewhere and get a certificate and become a naturopath. And I didn't realize that there is actually credentialed universities, medical universities for naturopathic medicine. And I know that both of you went out to, where was it?
Arizona.
Right, thank you. Yes. So how long was your training?
4 years.
Okay.
Wonderful. So you start out coming in with your bachelor's, and as long as you take those core classes in order to come into medical school. So it's a year of physics and a year of biochem and a year of chemistry and a year of biology and all the ologies that goes with that, right? And then you, if you get accepted into medical school, you're ready and you're set, because it's intense training.
So you have a very unique story, Dr. Johnson, in when you got started. When you made the decision to go to medical school, you had children and you already had adult children when you decided you wanted to be a doctor. That's unusual. And it's quite unusual. What motivated you to do that?
Well, there were several things that motivated me. I have a spiritual mom that asked me if I could do, if I wanted to be anything but my age didn't depend on it, what would I become? And I said, a doctor. And so she says, now go be it.
Oh, wow.
Well, obviously I did what she said and suggested, and the rest is history. But my children were all grown, and so they were off doing their things and what they aspired to do. And so I decided, okay, this is what I wanted to do.
And understand your son got his PhD as doctor at the same time you got yours, or same year?
No, just a couple of years afterwards, and it's in ecology and policy.
Okay, okay. And was it worth the sacrifice?
Absolutely. Now, when you're going through nothing, I'm gonna die, I'm not gonna make it. But it absolutely was.
And Dr. Stewart, you decided to go beyond the medical school on to become a licensed acupuncturist. Yes. Why? What motivated you to do that?
Well, when I was in medical school, we had a lot of chances to be on extended sites for the clinical work. And a lot of the clinical sites that I was at was either addiction sites or substance abuse clinics. There was an HIV and AIDS clinic as well, and I noticed that using acupuncture, we had results almost immediately.
Wow.
And acupuncture does not interfere with medication. So utilizing needles is a way of getting results without interaction of side effects or anything like that.
Wonderful.
So that was perfect for me.
Wonderful, wonderful. We're going to put a pin in it right there, and we're going to come right back. Significant advancements in healthcare have occurred over the last 2 decades. Caring for your health naturally has become the optimum approach that many individuals have chosen. Why? And what are they doing? That's next, so stay tuned.
Thomas, you've got prediabetes. But with more exercise and a change in diet, it can be reversed.
I've tried exercising. It just makes me hungry for bacon.
I love bacon too. And who really likes to exercise?
Not me.
Me neither.
Nobody. So we're good?
What? Oh, you still have prediabetes. Big time.
Welcome back. We talked about acupuncture. Now, how about we see acupuncture in action? Join me as we observe Dr. Paula Stewart provide an acupuncture treatment right now. Her patient, Joyce Drumming. Dr. Stewart, yes. This is your patient, and I know you're about to get started, so do what you do.
Okay, so I'm going to choose a point. I'm going to do an air point.
Okay.
And what I'm going to do first is just clean the area.
Okay.
And it's just going to feel just a little wet. Okay. I'm going to use a little needle. And we're just going to insert it into an acupuncture point.
An acupuncture point?
Yes.
Specific points in the body that...
Correct.
Okay.
Mm-hmm.
Okay. Wow. So you didn't flinch. Does it hurt?
No, it doesn't hurt at all.
Okay. Okay. You want to do another one?
Sure.
Somewhere else? Or another one in the ear?
Sure. So I'll use a different needle.
Okay.
And this one is a smaller needle. That one actually is probably a little less painless, or a little less pain, right?
Yes.
Okay,
That's a thinner
so
needle.
You, there are different points in the body
Yes.
that are associated with, well, you explain it, I can't.
So acupuncture, basically
Sure.
how acupuncture works is that it connects to the central nervous system. So it connects to the brain and to the spinal cord. And it connects by highways that we call meridians. Highways are just basically what we look at right now. So 495
Yeah.
is a highway. You have an entrance point. And if somebody doesn't know how to merge onto the highway correctly, you'll have a backup of traffic. That smooth flow no longer happens. Acupuncture's main role in the meridians and in the highways is to make sure that you have a smooth flow of traffic.
Nice, nice. Is this your first acupuncture treatment?
No, it isn't. I had it 10 years ago, but this time I had it because I was getting ready to go through breast cancer treatment just a month ago. And
A month ago?
A month ago.
Wonderful.
So I had this treatment along with what Dr. Johnson did with me with the jade treatment. So I had it once a week. I had acupuncture and I had the jade treatment.
Wonderful. So do you want to sit up a minute? Do you want to? Okay, wonderful,
Okay.
wonderful. So Dr. Johnson, what did you do? So you went through, you had breast cancer surgery?
Yes, I had it. I had a bilateral, or both breasts were removed June 13th of this year.
So that was 5 weeks ago
Yes.
today?
Yes, and the doctors were very surprised.
Wonderful.
Dr. Johnson was added to my team, and Dr. Stewart came there, and they both, they approved of both of the treatments that they were giving me. And actually, when I came out, they had never seen anyone have that kind of remarkable response.
4 weeks.
4 weeks, I was up and gone.
I have to say, I saw you 4 weeks after, which would have been last week. I saw you up and about, as effervescent as ever. That's a remarkable. No, but what did they say? It was the oncologist who said he had never seen
Yeah,
it
I had an
before?
oncologist. I had reconstructive surgery. I had a radiation therapist, and she was the naturopathic for the supplements and other kinds of things that they gave her.
Dr. Johnson was?
Yes.
Wonderful. So what did you do with the jade treatment? What did that comprise?
Well, the jade treatment is working with the lymphatic system, and the lymphatic system is a part of the immune system, and it also helps remove out waste that the body has, right? And it moves out inflammation. So I use the jade machine to help move out inflammation, so to make sure she didn't get lymphedema, which is the swelling of the arms that you can have after this type of surgery, and making sure that she was prepped before and then afterwards. So she didn't suffer with a lot of pain afterwards, or...
I never had pain.
Wow. Wow. Awesome.
I had a tightness, but never pain, and they
Awesome.
couldn't believe it. And I was able to move my arms all the way up in the air this way.
Wow.
Which they had never seen. You're supposed to practice on a wall, but I just was able to do it just like this.
Wow. Your body was prepared.
Prepared for it.
How long have you been seeing Dr. Johnson?
I've been seeing Dr. Johnson for 4 years.
Okay.
And she, in November, changed my diet. And there were a number of other things, supplements and all, never knowing that we were going to find cancer.
Oh, so that was before.
That was before, in November of 2017.
And you had the surgery. You found out about the cancer when?
In May.
Oh, wow. Just recently?
Just recently. And the surgery was June 13th.
Wow, that was quick.
Yes. So while I give them credit, I have to give it to the Lord, because He made sure
Amen.
that I knew that He was going to keep me from having to have no chemo, no radiation, and that was the end of it, and He told me that. So I never had any fear, because cancer is just a word.
Amen. Amen.
And the Lord Jesus Christ has already gone for my
He paid the
healing.
price.
He
Amen.
paid the price.
Amen.
And when you believe, that's what He said to me. You either believe or you don't. And I'll send you some folks that will help you get through this process.
Amen.
And it's
4 weeks later,
remarkable.
look at you, up and out. Wonderful. Wonderful. Well, thank you for coming in and joining us. And I appreciate you being so candid about your story and sharing, because the naturopathic formulas or the naturopathic treatments, I think, are really making leeway in a lot of people's lives. Now, I was introduced to homeopathic medicine in the 80s, and so I'm very much attuned to and akin to this type of medicine. I'd like for more people to know all about it.
Let me just say one other thing, and that is I've been in medicine for 45 years myself in behavioral health.
Behavioral health, right.
So this was not new to me. And what makes it so different, both of them have also worked with me on what I can do for myself. So I'm a member of my own treatment.
Wonderful. Wonderful.
And I still see allopathic doctors whom they work with. And so it's not instead of, it is also complementary as well.
Integrated health. Is that
Yes.
what they, okay. Very good. Very good. Well, I appreciate your demonstration. I appreciate your input and caring for this wonderful lady here. 71 years old, nobody would guess.
71. That's right.
Nobody would guess it. Nobody would guess it. So we're going to come right back in just a few minutes, okay? Now, that'll get you going, folks. I've had 2 treatments by Dr. Stewart, and I'm actually ready for the 3rd. But what are the benefits of naturopathic medicine and acupuncture? That's next. Stay tuned.
Your girls have been with you through every moment of your life. They were with you when you felt unbreakable, and with you when you had your heart broken. They were with you when you shared your love with the world, and with you when she became your world. They're still with you right now. But how well do you know them?
Welcome back. What is the benefit of naturopathic medicine? What's the benefit of acupuncture? And how do they complement each other when they work together? Ladies, welcome to joining us. Thank you for joining us again, and welcome back to the show. That was a great acupuncture treatment. We appreciate Joyce Drumming joining us as patient. And so, but tell me, what is your area of specialty? Let's start with you, Dr. Johnson. In naturopathic medicine, what is your area of specialty?
So I have what is like a family practice. So I see the babies all the way up to my seniors. My specialty is dealing with the metabolic syndrome, so hypertension, diabetes, also cancer, and all the chronic, conditions that are surrounded with that, and autoimmune diseases, and so everything else in between.
Wonderful, wonderful, wonderful. And you also focus on clinical nutrition.
That's correct.
Okay, so what does that involve?
Well, when the body, you're asking the body to do something, right? You want it to bring down blood sugars. But if it doesn't have certain minerals on board, it may not be able to do that. So even though you may trying to eat correctly, but the body is missing something. So we have to address that and sit down and actually go through and see what is it that you're eating also, because sometimes there can be good things that you're eating, but they're just not good for you.
Okay, very good. Dr. Stewart, your area of specialty, you're both are doctors of naturopathic medicine.
Yes.
You also as an acupuncturist as well. But within naturopathic medicine, what is your area of specialty?
So I focus on women's medicine, which would include fibroids, endometriosis, menopause, any type of osteoporosis, osteopenia. I also focus on pain, especially with acupuncture being on board. So if people have headaches, patients have migraines, for instance, back pain, or again, knee or joint arthritis, that would be something that would be addressed both naturopathically and with acupuncture. I also focus on infertility, kind of going back to women's medicine, so infertility as well. I focus on stress management, so those who have PTSD or anxiety, and also conjunctive help with conjunctive therapy with preparing for surgery and post-surgery recovery. So that has to do a lot with nutrition as well, just making sure that the body is able to go through that process and recover at the optimum rate.
Speaking of pre-surgery, Dr. Johnson, I know you both worked with the patient we had, Joyce Drumming, prior to her surgery, and you mentioned that you used the Jade machine.
That's correct.
Tell us a little bit about what the Jade machine does, what it is and how it works, and then what else did you do to help prepare her before the surgery?
So the Jade machine uses microcurrent. No, you don't get shock by it or anything like that, but it helps to allow the cells to be able to have the right current that it needs for each particular cell. And also it has a low-level light laser that goes with it as well. And these things help move out the inflammation and bring blood supply to the area that needs to be. When it goes through the lymphatic system, it comes into the thoracic ducts and it dumps into the kidneys and you urinate it out. So it's a cycle that goes through. So it's just a way of just getting things to move and flush out.
What other things did you do, or was there
I prepared her
anything
nutritionally to make sure that she'll be able to heal properly in that process. Now, before she goes into surgery, obviously we stop everything so that nothing interferes or, with any of the medications that they're going to give her, and that she's not bleeding excessively or anything like that. So we stop about a week or two out prior to that. But she didn't go in deficient nutritionally.
And you actually, she mentioned, Joyce Drumming mentioned that she had you signed up to become a part of her team, her medical team. In an allopathic office or in an allopathic environment, you were able as a naturopathic doctor to come in and be a part of their team. So that meant you were aware of everything that was going on with her as the other doctors were.
That's correct.
That's
so
wonderful.
That goes back into our training. So we're trained in laboratory diagnostic, and we're trained to be able to read these things that come in. Of course, you're going to have your specialists on board, but we just follow suit with them and come up with a program that's best suited for that particular individual.
That's wonderful. And so I know that Dr. Stewart, you treat women's health. You also mentioned, though, that well, let's go back to Joyce Drumming. Prior to her surgery, what did you do to prepare her?
Well, any type of surgery is going to have a little bit of anxiety towards it, correct? And you never know what's going to happen. You might start having some type of reservation towards having surgery. So my main focus with her was making sure that she felt prepared emotionally for surgery. Not only her body, but emotionally, because we can't keep that separate. The entire person has to be treated. And so that was our focus for her, is to make sure that she felt okay, and she did.
Do you all focus on the spiritual aspect when you're talking about, you know, the total person? Do you address the spiritual aspect of that person before a surgery, and as a part of maybe even the emotional perspective? Do you address that with them?
Absolutely, absolutely. Again, with Ms. Drumming, that it's something that cannot be separated. I don't believe that it's something that can be separated. In naturopathic medicine, we're trained to make sure that we don't separate it, treating the entire person, mind, body, spirit, holistically. And so that's the way we approach it.
And Dr. Johnson, I know you also work with men as part of your family practice. What kind of things are you able to do with men? What kind of treatments or care are you able to address?
It's the same care. They come in with the same things, with the exclusion of women's issues, but they come in with the same things, be it prostate cancer, hypertension, diabetes, eczema. So there's many different reasons as to why someone would search me out and come to me. And so depending on that, I come up with a treatment plan specifically for that condition.
What would you say are some of the benefits that naturopathic medicine would have versus, say, an allopathic? If you're taking the path of allopathic medicine versus naturopathic, what are the benefits they're going to have through naturopathic treatment?
Okay. Yeah. Well, one of the things is, let's say that this person have been diabetic or pre-diabetic, and we're able to help them reverse that out. And if they're able to maintain it, perhaps they can decrease their medications that they're on, and or stop their medications. But that's in conjunction with their primary care physicians that we're doing this with. So there are many different benefits in that way that can come out of that. And sometimes people think that you don't necessarily have side effects because it's natural medicine, but with anything you put in your mouth, you can actually have a side effect too. But we see less side effects in many areas, but not, we can never say that you won't ever have a side effect.
I'm certain they're not as drastic as traditional prescription types. So. And Dr. Stewart, what do you find, since you do both, the naturopathic medicine as well as the acupuncture, what have you seen, or what do you believe is the added advantage of adding the acupuncture to the treatment?
Well, I believe prevention. So finding where the patient is right there in that moment when they come to your office, and hearing their story, understanding that there is an emotional component, making sure that we address that component of emotions before it gets to a point where they can no longer actually function. So prevention, preventing further sequelae of depression, or actually carrying out a plan of suicide or anything like that. So preventing the further disease process or diagnosis process.
Wonderful. Wonderful. Well, ladies, I have enjoyed you on the show, doctors, excuse me, both you, Dr. Johnson, as well as Dr. Stewart. I appreciate you both. That is something that is not quite common in our community, and so I am excited to have you on the show to just have everybody know you're here and what you do. And your practice is All Things Natural Wellness Center,
That's
right?
correct.
Right there in Greenbelt?
That's correct.
Okay, so
in Lanham, actually.
You want to give your website address real quick?
ATN, that's A as in apple, T as in Tom, N, wellnesscenter.com.
Very good. Thank you so much. I appreciate you both. I've been a believer in natural medicine since 1980. So do your research and consider natural options whenever possible. Minimize prescription drugs, eat a healthy green diet, exercise regularly, and get plenty of sleep. That's it for now. We hope you enjoyed the show. Remember to call in the All Things Wellness All Things Natural Wellness Center, though. And join us next time, won't you, for the Clarion Call. Until then, I'm Janice Liggins. Blessings to you.